Bismillahirrahmanirrahim. Assalamu alaikum. My name is Bahar Abdullah Haq and I am here to present the topic most effective cephalosporin in hospital care. Cephalosporins are the class of beta-lactam antibiotics which act by inhibiting cell wall synthesis by binding to the penicillin binding proteins. They have some common adverse effects which include skin rashes, pruritus, Steven-Johnson syndrome, nausea, vomiting, etc. Cephalosporins have been classified into the 5 generations. Here you can see first generation cephalosporins. They act as penicillin G substitutes that are resistant to the staphylococcal penicillinase. They also have activity against E. coli and Klebsiella pneumonia. Second generation cephalosporins. These include cefaclor, as you can see, many other medications which are listed in the slide. They all display greater activity against the 3 additional gram-negative organisms, Haemophilus influenza, Enterobacter aerogenes, and some Neisseria species, whereas activity against the gram-positive organisms is weaker. Third generation cephalosporin include cefixime, cefidnir, and many others. These cephalosporins have assumed an important role in the treatment of infectious diseases, though greatly inferior to the first generation cephalosporins in regard to their activity against the gram-positive cocci. The third generation cephalosporin have enhanced activity against the gram-negative bacilli. Ceftriaxone or cefotaxime have become agents of choice in the treatment of meningitis. Ceftazidime has activity against Pseudomonas aeruginosa. Fourth generation cephalosporin, cefepime, is the most clinically useful cephalosporin and must be administered parenterally. Cefepime has a wide antibacterial spectrum, being active streptococci and staphylococci, and also effective against the aerobic gram-negative organisms such as E. coli, Enterobacter, Klebsiella pneumonia, Proteus mirabilis, and Pseudomonas aeruginosa. Fifth generation cephalosporin, which include ceftaroline, they are exhibiting the broad spectrum activity against gram-positive bacteria, including MRSA and extensively resistant strains such as vancomycin intermediate and Staphylococcus aureus and heteroresistance VISA and vancomycin resistant S. aureus. Now, let's look at the case study. A 30-year-old male patient of 73 kg weight, 53 feet height, comes with complaint of lower abdominal pain and fever, body aches since last 7 days, and loose stools and vomitings 2 to 3 episodes. So here we can see the subjectives are fever, chills, headache, body ache, loose stools, vomiting. And when we ask the patient to do the laboratory tests, we come to know that his hemoglobin comes to 10, WBC count is 5300, platelet 15, RBC 4.41, and urine microscopic examinations have PVS cells, 6 to 10 cells. Assessment will be based on the subjective data and objective data, and by both of these, we have assessed that the patient is having urinary tract infection. Now come towards the treatment plan. The goal of this treatment is to lower the body temperature, to provide the relief from headache and body ache, prevention of vomiting, and to eradicate the infection of the urinary tract. Treatment given to this patient will consist of paracetamol injection IV 150 mg stat. Paracetamol is antipyretic and it inhibits the prostaglandin synthesis or through active metabolite influencing cannabinoid. Our second treatment will be pantoprazole injection IV 40 mg BD. It is a proton pump inhibitor and it inhibits the gastric acid production and prevents the excess acid production in the stomach. Next will be Rocephin, that is ceftriaxone. It is the cephalosporin antibiotic. We will give its injection IV 1 gram BD. And last will be the Norflux tablet oral 400 mg BD. It is the fluoroquinolone class and it is used to treat the UTI and bladder infections. It functions by inhibiting the DNA gyrase and thereby cell division. And this brings me to the end of this presentation. Thank you very much. Allah Hafiz.